So I do my research. I've seen you obviously on TV quite a bit, which is cool. I'm sure you have a good time with that. But I always like to understand where people come from. I've always been fascinated with people's stories, in sports, medicine, entrepreneurship, you name it. I always like to ask, was it your dream to become a doctor? Was it always something you wanted to do, or?
I mean, I guess so. I mean, as a child, I just always wanted to be a doctor for no other reason. I just think I like challenges. And so when people said it's hard to become a doctor, I'm like, well, that sounds like a good thing to do.
Yeah. No, I bet. I bet. So you were the little girl with like the medical kit and you'd get all the toys.
Yeah, pretty
That's
much,
all
pretty much.
that. What do you love most about it?
During my entire career through training, I never had an exact specialty that I knew I wanted to get into. But as time went on, I realized that I want to make an impact on somebody. And in my specific profession, I find cancer at the earliest possible stages right now. So I'm essentially giving people the best chance at surviving from their cancer. And so I had my grandmother died from advanced breast cancer when I was actually in medical school. And with breast cancer being one of the most common cancers and one that's supposed to be undergoing screening, there really shouldn't be a lot of cases of advanced breast cancer. So I wanted to spread the word on early detection.
Got it. So do you think is it a screening issue that causes this for a lot of people?
Well, I think there's a lot of reasons that there's still advanced cancer diagnoses. One, people aren't getting the recommended screenings. Two, they don't necessarily know what they're supposed to do, but also unhealthy lifestyle behaviors increase the risk of multiple cancers, including breast and colon and some of those more common ones.
What would you say in terms of these lifestyle behaviors? Which are the ones that you think have the greatest, I guess, would lead to cancer?
Sure. So unfortunately, as I go into in depth in my book, is Americans unfortunately don't eat as well as we should, and we certainly don't get the same amount of physical activity that we probably should. So we lead pretty sedentary lifestyles, and that's not necessarily just because we're lazy. It just means that that's where our lives are at right now. Our jobs usually are making us sit. We're commuting in our cars. We're sitting. We're a much more digital world right now. We use drive-ups for everything. We have drive-up ATMs, drive-up everything you could imagine. We're barely moving anymore. So all we really need to do is just move a little bit more. It doesn't mean that we have to be, a gym rat or play some sport. It just means we need to move more. So me at work, I take the stairs instead of the elevator. I'm walking around my building a couple times a day. Just the little things make a really big difference. But then also in terms of diet, Americans, again, we're always in a hurry, and myself included. So we want something easy and we want it now. That usually equates to some sort of manufactured foods or even a fast food, not necessarily your fruits and vegetables and all that would go into a home cooked meal.
So when you say manufactured foods, because I think there's people out there that are like, what are manufactured foods? I eat this bar and it says it's really good for me. Is that considered a manufactured food? What do you consider that?
So, and, again, it's funny because I kind of call out certain things in my book because people will think that they're eating something because it's labeled that it's going to be healthy. But when you actually break it down, there's so many preservatives and sugars and other things in it that you're not necessarily thinking. So just like freeze dried, or what's it called? The fruits, the dry fruits.
Yeah, dried fruits, yeah.
I don't know why I can't think of that word right now, but so like dried fruits in themselves, you would think I'm having fruit. This is a great thing, isn't it?
Yeah.
Unfortunately, there's usually packed sugars inside of that, so they're not that great for you. Same with even just certain white breads. If you look at the ingredients on something, and in the first 3 ingredients, there's something other than something that's very natural, like a water, then it's probably, or something that you can't pronounce at all, or like natural color number 4, all of those things probably mean that it's not that healthy for you. I love to see something that just says like, I don't know, apple and water. Like, all right, that sounds pretty good to me. But again, I'm not a health nut by any stretch of the imagination. I like wine. I will eat chocolate when I want, but I'm more of the everything in moderation kind of person. So I know if I'm not as physically active a certain week, then maybe I can't have that dessert that night. And if I am going to have a dessert, maybe I'm just going to have a couple of bites. Do I really need to finish the entire piece of pie? I know it's really hard not to, but those are the little changes that we can make in our lives. And those little changes will actually go a really long way.
Yeah. I found that when Whole Foods sort of hit the scene, it was great because it created an awareness, but it confused a lot of people. I used to meet people that I would coach and say, hey, I got a chocolate chip cookie, but I got it at Whole Foods. As if it's
So it must be good.
Yeah, no calories, no sugar, right? Because it's at Whole Foods. So I appreciate that point. I think people are more confused now than ever on their health. There's so many options, so many diets. You have keto, you have, should I fast? And nobody really knows what to do.
Well, so, I talk a lot about certain diets because for me, anything that's restrictive or, if you have to write down the rules for the diet, that is probably not going to be a really good diet for you in terms of long term. The problem with those restrictive fad diets, keto, paleo, and whatever others, they're really hard to maintain for the long term. So although you may actually lose weight initially, the majority of people will not only gain that weight back, but then they actually gain a few pounds more.
Yeah.
So for me, if you really just break it down and look into what is best for longevity and long-term mental and physical health, it's really following something along the lines of the Mediterranean diet, which has been around for decades. And actually, it's been around for centuries. If you just look to people in Greece and Italy and the places where people actually live much longer and live healthier longer. And that is just fish, lean proteins such as chicken, vegetables, and fruits. When you go to the grocery store, if you just stay around the periphery, you're much better off than if you go through the aisles, because all of the preservatives and the stuff that I'm talking about, the manufactured foods, they're really in those aisles. The periphery is where it's at. That is your fruits, your vegetables, your dairy, your meats, your seafood, and now you can check out.
Right. Yeah. It's pretty smooth. Go clockwise or counterclockwise, whatever you want, and get the hell out of there.
That's right.
No, that's cool. So how did you get so into like the nutrition side of things? I mean, I know you said you're not a diehard, but how did you connect, what you were seeing, I guess, in imaging and cancer diagnosis with food? Because there's a lot of doctors out there today that are somewhat one-dimensional. They still haven't fully made that connection yet, believe it or not.
Right. Well, so as someone whose whole goal in my day job is to diagnose cancer at the earliest stage possible, I give people a cancer diagnosis every day. Yes, the cancer may be small, but I'm still telling people they have cancer. And in that conversation is when the person says to me, I want to live a healthier life. Why does it take a cancer diagnosis for someone to say, I want to live a healthier life? Because the truth is, if you live a healthier life now, you may actually prevent that cancer diagnosis. Do you know anywhere up to 40 to 50% of all cancers could actually be prevented through certain lifestyle changes? So when I was researching for my book, I broke down my book into the leading causes of death in the United States: cardiovascular disease, cancer, and we also go into mental health. And from there, I showed how much of those things could be prevented by certain diet modifications or exercise. Don't get me wrong, my book is not a self-help book by any stretch of the imagination, but you have to acknowledge the fact that what we consume, what we put into our body, has direct correlation with the outcomes, meaning the diseases. So look at COVID right now. We as Americans are rendered vulnerable to COVID-19 because we have such a large swath, a large epidemic of chronic illness in our country. Many of the other countries, it is only the elderly that are dying or falling ill to this disease. Unfortunately, in the United States, the fatality rate of the younger populations, the 35-year-olds to 55-year-olds, it's actually higher. And that's because we have more obesity, more type 2 diabetes, more chronic kidney disease, and more cardiovascular disease. And unfortunately, about 80% of all of that may have been preventable through better diet and increased physical activity.
Okay, so I have a question for you. Do you think the fact that there's so many medicines available today, it just sort of gives people a free pass? Like, hey, you know what? If I can eat like a slob, my blood pressure is up, I'll just take a pill to get it down. Is that sort of the mentality that people are programmed with today? They're unwilling to give up the things they enjoy because they know that there's a pill?
Well, so that's a very good question and a concept I talk about in my book at length, because I do think on one side there's conspiracy theorists saying it's the drug industry and pharmaceutical industry and doctors that want to keep us sick because they want us taking these magical pills. But
Mm,
on the flip side of that is doctors saying, well, people just want the easy fix, a magical pill. They don't want to actually work hard for progress. And so, it's everything in between. I think that we unfortunately have gone towards just demanding instant gratification, and that's the Achilles heel of Americans for the most part, and myself included.
mm,
We don't necessarily have the time or the energy to really put in the work that would require lifestyle changes.
mm.
But let me tell you, that's the one thing that would not only benefit your individual self, but society as well.
Yeah, no, it's true. What are your thoughts on on mental health? I know you said that's in the book, and we'll jump in the book as we're going here, and then we'll get further into it. But mental health, what do you think? Where's your stance on that? I know there's some big problems out there, especially
Well, I
men.
mean, mental health affects every single one of us. I mean, we all know someone who, I mean, mental health isn't just, schizophrenics and those who have psychotic breaks. I mean, it encompasses everything from just down to people feeling anxious and depressed right now with what we're seeing with COVID-19. I mean, mental health is just as important as physical health, because it doesn't matter how strong you are physically if mentally you're suffering. So you want to think of them as one single body. You can't separate physical health and mental health. And unfortunately, mental health just does not get the same attention as physical health does. And one thing that I've been talking about a lot during COVID-19 is I'm very worried about the long-term mental consequences of the shutdowns, the social distancing, the unemployment. And we need to be focusing on that just as much as we are focusing on social distancing and wearing masks. And so I think that people need to really accept that and have less of a stigma of reaching out if they are feeling that they need help.
Yeah, I have a client. I just got an email yesterday, and he said, "Listen, I live in New York, and right now I feel like I'm being told what to do in every aspect of my life, and what I can do and what I can't do." He says, and I'm really feeling it. I'm feeling down. I'm feeling frustrated. I'm not ambitious. I don't feel like working out. What do you suggest?
Well, I mean, it's a double-edged sword, because if you actually work out and you get up your heart rate and you break a sweat and you release those endorphins, that's actually going to make you feel better mentally. That's going to help those feelings of depression and those feelings of anxiety. But when you're having feelings of depression and anxiety, it's really hard to have the motivation to work out. So, it's really tough. And, you just want to motivate that person and say, look, I'm telling you to work out, it's not just because I want to make sure your biceps are getting better.
Right.
You're working out to combat those feelings of feeling out of control and your mental health. And so you want to encourage them to keep going and keep doing it.
Which is even more the reason why it's amazing how people see, training for the physical body and training for the mind as separate. In sports, I train athletes. We train physically, not just for physical strength and power, but for mental confidence. In a sport that's, hey, me versus you, I can beat you if I'm mentally stronger, but how do I get there? And I think, and tell me if your thoughts on this, that mental sort of conditioning today is distilled down to you either meditate or you don't meditate. I
So,
see a
I
lot
mean,
of mindfulness is meditation. That's it.
right. Well, and I've never been someone who's been able to meditate. I'm that person at yoga who's going through the list in my head of what I need to be doing for the rest of the day. And no, mindfulness is not just someone who's able to go kumbaya and be alone in a quiet place. Being mindful and working on your mental health is picking up the phone to call a friend if you're feeling something, maintaining that level of social connectiveness, making sure your body's being worked out by increasing the oxygen to your brain, eating healthily, fish and legumes and nuts, all of that. All of these things are good for your brain, which does help with the mental health aspects. And there's actually foods and teas and spices that can help with feelings of anxiety. And one of the things that I do every afternoon when I'm in the busy hospital, I try and have a green tea with turmeric in it, which
Mm.
has antioxidants and anti-inflammatory properties, and it's relaxing. It also just gives me a little bit of that boost I need in the afternoon. And that's good physically and mentally.
Yeah. I have to ask you, are you a coffee drinker as well?
Yes, I am. About 3 cups a morning.
Okay, got it. Because I found too, some people handle coffee really well, and some people with a predisposition to anxiety, that coffee just throws them off the wall, but they continue to go for it. So I guess it's also too, when it comes to mental health, physical health, you have to understand how your body, as an individual body and mind, respond to things as well.
Well, one thing that I talk to people a lot about is you know your body better than anybody else. You know what's good for you, what's bad for you, more than I can ever tell you that. So if you are starting to feel a certain way, keeping a food diary or an activity diary, like for about a week, and then you write down when you start feeling a certain way, like what did you do that morning or what did you do that afternoon when those feelings crept in? Did you find that you maybe had junk food earlier that day? Did you find that maybe you drank a little too much the night before? Are there any patterns that emerge when you start feeling a certain way? And if they are, then look at it and try and correct it.
Yeah, no, it's great. I connect with what you're saying quite a bit, because I preach a lot of this interconnectedness. You can't have one without the other. Everything goes hand in hand. But I feel like, again, everybody's being sold sort of these independent solutions to the problem of, hey, how do I improve health and vitality?
Yeah.
So your book, did you ever anticipate writing a book, or was it something that was that passion project for you?
So I have 3 children, 3 boys. My oldest, when he was going away to college, I decided to write a book, and that's how I channeled my emotions. Some people take up knitting, some people take up other forms of crafts. I said, I'm going to write a book. And I started writing about, I started getting very upset listening to politicians on both sides of the aisle fighting over healthcare. And one telling them one way is the only way that'll work. The other one saying, this is the only way that'll work. And as a physician, I was like, you guys are both crazy, because nothing's going to work when we have so much preventable illness. I mean, they're just putting Band-Aids on things. And so the whole crux of my book, so it's Make America Healthy Again, but the subtitle is How Bad Behavior and Big Government Caused a $1 trillion crisis. So I really go into, why is our healthcare system so expensive? Why does everything cost so much? Why are we being pushed to the state where people are demanding for single payer healthcare? And I go in through the history of it, how it was kind of made, but then I really talk about the leading causes of death and disability in the United States, how much it costs, but how much of it is preventable. And then it's kind of shocking when you really start seeing the numbers and how it's broken down. But the good news is it's not a depressive book, because I say, but the good news is there's very simple ways to fix this. And all you have to do is X, Y, and Z, and that little bit will make a massive difference if just enough of us do it. So I wrote the book now a year and a half ago. Of course, it came out in the middle of COVID-19 when all bookstores were closed, but it was just so interesting how the content of it couldn't have been more relevant than what we were dealing with COVID-19.
I was going to say, it's kind of perfect timing. Everybody was home looking for something to do, worried about their health. And here's this book that hits the shelves, catchy title. And, and then I felt like you were also rising as well at the same time with your sort of second career with Fox, if you will.
Yeah, well, so I work full time in a hospital, but then I've been with Fox now for about 4 to 5 years. And when everything shut down, my hospital system and Fox both were in my house that afternoon, putting up a home reading station and a home studio. So yeah, I was on TV about multiple times a day, 7 days a week for a solid 2 months straight. Things have slowed down a little bit now as the hospital work is certainly picking back up. I'm back in the hospital multiple days a week, still reading from home a couple days a week, but we're staying busy, that's for sure.
Yeah, absolutely. So I love to dig into people's personal process too. It's just, again, I think people love hearing about what's behind the person. They see your success, they see your accolades, but like, what's behind it all. So I'd like to even just start with the book. I write books myself. Did you enjoy the process?
Did I enjoy the process of writing the book? I found it exhilarating doing the research, kind of a lot of those, wow. Because I thought that I knew a lot about it. But when you really do your research and you come up with the specifics, it was pretty eye-opening to me as well. And one of the funniest things is my dad read the book after it was published. And he said to me, he's like, did you write this or did you have someone write it for you? It's like, hello, do you not know what I've been working on the last year and a half? He's like, I know, it was just like so well written and there was so much research in it. Like,
come on, Dad, give me some credit.
Hello. Well, on the flip side, my mother's like, of course you wrote it. It was as though you were speaking.
Yeah.
So I would say I had a lot of fun writing it, you know, the back and forth, the editing process, and some of those intricacies, you know, get a little, yeah, I'm not gonna say tiring. They made the book significantly better, but you're so excited to get the word out that you just want to speed up the process. And so it seemed like it took longer than I wanted it to, but again, everything happens for a reason and happens the way it's supposed to. So I think all of those edits, the revisions, even the title change, because that wasn't the original title.
Okay.
I think it all just makes it a much better book. And I'm very happy that it came out and it did so well. And I've gotten so many notes and letters written to me about how people have really found motivation and help in the book. And it's a wonderful feeling.
Yeah, it's pretty cool, right? You have this idea, you have this vision, and now all of a sudden, you know, this whole community of people connect with it.
Yeah.
It's like they were looking for something like that. No, that's pretty cool. And growing up, how were your parents? Pretty supportive, pretty motivational?
So my parents, my dad's a lawyer, my mother is a child therapist, and I have been I guess a type A go-getter my entire life. And thankfully I had two parents who were right there, willing and able to do whatever they could to support some of my efforts. And, you know, I was an athlete. I was a competitive gymnast, cheerleader, who had many injuries, 3 ACLs by the age of 18. I've had both of my shoulders, the cuffs redone. You know, I'm like an old woman right now with all of these injuries. But, you know, it definitely, the discipline, the physical activity constantly, it really made me the person I am today.
Yeah. So I love, you know, hard chargers, type A people, you know, world changers. How do you deal with the pressure and the potential for anxiety that goes along with that life and being that type of person?
Well, I drink wine. Now, that's a great question. And I'm somebody who kind of runs with a baseline low level anxiety. Some people, anxiety can consume them and actually paralyzes them so that they aren't able to do something. I have found ways to channel some of my anxiety, and that makes me, in my opinion, even more productive.
Okay.
But you know, it is a matter of talking through things, acknowledging that you're feeling a certain way, because if you just push it down and you don't recognize that you're feeling it, it can eat at you physically and mentally. So I acknowledge it. I know when I'm feeling anxious, and I literally will say to myself, okay, I'm having a day where I'm feeling a certain way. And so, you know, things that I do, yeah, I will have a glass of wine occasionally when I'm feeling that way, especially after a long day of work. You know, I'm not drinking a bottle by myself. I don't think that's healthy, but I think it's okay to have a glass of wine. You know, and I'll call my mom, or I'll just pick up a book and just try and read a book. You don't want to be making massive decisions or working on something really important when you're feeling that way. You want to try and let your mind and your body relax. And if you find that you're not able to do that yourself, that's when you pick up a phone and you call a doctor and see if they have any other suggestions.
Yeah, no, that's good. Do you find that, you know, you're in a competitive career path, both at the hospital, and again, there's a lot on you being a mother, you know, being a wife, doing the Fox thing. How do you just, are there any things that you do on a day-to-day basis besides wine and you know, even calling mom to deal with it? Like just sort of sorting things and keeping yourself organized with all of it, I guess. Is this the planner? Is this the planner coming? Oh, there they are.
I am a list person.
Okay, there you go.
List person.
Okay.
So I like lists because I like the check marks.
Okay.
Because the check marks give me that sense of satisfaction. Like all of a sudden I've completed something that day. And instead of having it jumbled in my mind of everything that needs to be accomplished, if it's written out, it makes it much more tangible, much more able to be conquered. And every time you do a little check, it doesn't mean you have to get it all done that day. Yeah. But at least it's in front of you and you know what you have to do. You know, also, if you really are struggling, so when I'm at the hospital, walking around the outside of my building, I do that multiple times a day. And that is just like a reset for my mind. I am not someone who gets to the gym every day. I barely get to the gym. but I have physical activity in other ways in terms of stairs and walking around the building and swimming in the pool in the backyard or trying to play tennis as much as I can. I try to do that at least every day, one of those activities, just to make sure that I am having some physical activity, because as I mentioned, physical activity is good for the body and the mind.
Yeah. How about goal setting? Are you, there's a lot of talk about goal setting. Do you have your, quarterly, annual, 5-year, lifetime goals set up? How do you go about that?
I mean, I still am wondering what I'm going to do when I grow up. I mean, so no, I definitely am not the person with the 5-year, 10-year, 20-year plan in front of me. I am more like, what do I want to do next?
Okay.
But that, again, is a double-edged sword in the sense that if you're always wondering what's next, are you ever really enjoying that moment? And so that's something that you want to focus on, because you want to have goals. I had a goal. I wanted to graduate medical school and be a doctor. Okay. And then I started doing commentary for TV. Okay. And then I got the contract with the TV. Okay. Then I wrote a book. It's like, at what point do I just say, hey, I made it? Like I've hit every goal that I've put out in front of me. So although I still have more goals, I also am trying to really change my mindset right now. This is me personally, to make sure that I'm truly enjoying all that I've accomplished and make sure that I'm living in the present now. Because although goals are very important and it's good to always stay motivated, you also want to make sure that you are relishing in your prior accomplishments and being okay living in the present.
Yeah. So how do you do that? Because I again, coaching a lot of type A's, that's the one thing. They're always so focused on forward. They don't look back at the wake that they've created or,
Yeah.
The accomplishments. They're just what's next, what's next, what's next. How do you, is it while you're playing tennis or you're up doing those walks where you're sort of grounding yourself?
Well, I don't know. I'm working on it. It's a work in progress.
You're in the process.
But I mean, it's just a matter of stopping. When you feel yourself getting antsy or being like, all right, I'm ready for the next one. I'm ready for the next one. It's almost like if you have like a 20-year-old who wants to get a tattoo, say, all right, write down that design that you want for your tattoo right now. If a year from today, you still want that design, go get your tattoo. I'd say that with people's goals too. Like if they've just reached a goal, they're like, okay, now I'm going to do this next. Like, let's take a pause for a second. Why don't we write this goal down and then give it a month, give it 3 months, go back to that. Is it still as important to you to hit that goal or not? But it shouldn't be out of an impulsivity because you just have to get a goal. Like make sure that that goal is really something that means something to you. You want it to be meaningful.
Yeah. No, it sounds like too, you're a very visionary person for yourself rather than just setting a hard goal. It's sort of, this is the vision that I have. I want to create the book and and then you just sort of make it happen once you set your visions on things. Is that a fair assessment?
Yeah, well, I am definitely that person who, if I say I'm going to do something, let me tell you, it's going to get done one way, shape, or form. And so, yeah, it's not that I'm not hung up on the specifics of something. It's just if I want to do something, I'm going to do what I can to get there. And you're going to be your best advocate. So one thing about me that's a little bit different that unless you're an avid Fox viewer, you probably don't know. But so I said I have 3 kids. My oldest son is 20 years old. My other kids are 7 and 5.
Okay.
My 20-year-old I had when I was in high school. So not the most planned event of my life, but definitely made me the person that I am today. And so it occurred to me quite clearly back then that no one's going to work harder for my life than me. And while we need to make sure that we surround ourselves with a great support system, because there will be times when we fall and we need someone to help us get back up, we're truly in charge of our lives. We're in charge of our mental health, how happy we are. We're in charge of our physical health, how healthy we are. And we're in charge of our level of success.
Yeah. One of the questions I had written down based on that is, what are some of the lessons you teach your kids? And I think probably it's along those lines, I would say, whether it's through your example, living example, and or the words that you speak to them. I think a lot of parents today, some of them are so focused on making a living that they forget to raise their kids. And it leads to, some of the things that we're seeing now. But what would you say is, some of the things that you tell your kids, and some of when you have them by them, alone or on a vacation, what are you sharing with them to keep them motivated, inspired, on path, and excited about their future?
So in the book, I kind of talk about how we are doing our children a disservice. Maybe we're not physically present, we're not emotionally present, but we're also causing the anxiety levels that we're seeing in our younger generations right now. And at the end of the day, you have more teen suicide occurring than ever before. And so my message to my children are, I just want you to be happy. There are certain things that matter in this life, and then there are certain things that don't matter in this life. Yes, I want to make sure you get through schooling. Yes, I want to make sure that you're healthy. I don't really care if you go to an Ivy League school. I don't care if you're the captain of every team. I just want to make sure that my children are healthy. So I try to instill in them lessons that they can take with them their life. We talk about nutrition. We talk about physical activity. We also talk about, I am much more for positive reinforcement than negative reinforcement. Although I take things away when we're playing tennis or some sport together. Like I'll have one child say to the other one, like, that was a terrible hit. Like, I don't want to hear that. You say, that was a great hit, or you give some sort of advice on how to be better. But it's how you start treating each other as children, and that's going to be lifelong for them.
That's cool. Do you think being a younger mother has allowed you to understand them a little bit better than most?
I would say, I don't know if it allowed me to understand them. I would say my oldest son and I kind of grew up together.
Okay.
It was definitely not the easiest time. He went with me to college, to medical school, to internship, to residency, and to fellowship. So it was definitely a busy time.
So he's going through college twice.
Exactly. So now he's in it. So, it was just more of it was a steep learning curve, and you learn from your mistakes. And I can say, doing it the second time around now, having younger children, I'm able to be more of the mom that I would have liked to be. I am much more mature, but I am also able to kind of relish in how I was much younger mother with my first son, and I'm combining them together, meaning I'm not taking things as seriously. I'm trying to maintain that it doesn't have to be so formal. You can just have some fun. And you can remember that it doesn't have to be a picture perfect home with a white picket fence to actually have success. And that families come in all different shapes and sizes, and it's just what you make it. And home really is where your heart is.
Yeah. You come across as the type of person that, you could have an open conversation with your kids and your family, which is cool. I think a lot of kids are missing that and needing that today. Their best friend is actually this, and this is where they get their information, and they have a greater relationship with their phone than they do their siblings or their parents. What are your thoughts on social media today, and just sort of this phone addiction that I have it to some degree. I have to take my apps off the phone and all that, but.
Well, we all do. I mean, that's the new normal. I mean, I start talking about, the mental health. In the mental health chapter of the book, I really talk a lot about social media. And I think I'm just glad that I have 3 boys, because I'm not sure how to raise a girl in today's environment when you have, the American royalty being the Kardashians, and the physical appearance that they are born with is just a suggestion. I mean, everything can be airbrushed and filtered and plastic surgery and all of this other stuff. And they have this very skewed sense of reality. And when all you're doing is being on Instagram, I mean, that's everybody just putting their best foot forward. And that's not just kids, that's adults too. Everyone's trying to make it look like they live this picture perfect life. But the truth is, that's absolutely not what it is. And so when someone is struggling at home or feeling anxious, it's really hard to see everybody else's best foot forward, which is why we have such high levels of depression, anxiety, and attempted suicide right now.
Yeah, I guess Instagram has kind of become just the new real-time photo album of, like, when we were growing up, where you actually had the hard photos,
Mm-hmm.
which was probably a little bit better. You're capturing those great moments, but now it's sort of in real time, and people are always comparing themselves to the lives of others, which is super dangerous and definitely a growth inhibitor, I would think.
Yeah, I agree.
So I have one more question for you. I always ask this question. I call it the Becoming a Champion show. I always feel like we're all on a road to becoming a champion. I don't know if we ever get there, but what does the word champion mean to you, being a former athlete and now an all-star in what you do?
Champion to me personally, I actually use that when I talk to patients, that they have to be the champion of their healthcare team. And that is just someone who works really hard towards a goal. It doesn't mean that they necessarily achieve that goal. It doesn't necessarily mean that they're winning at anything, but it's something that means something to them and they're doing what they can to get to it.
Got it. I like it. I like how everything that you speak of sort of throws it back in the other person's lap or the patient's lap. You know, we have to take control of our own lives.
I can give you the information and I can tell you things to do to make yourself healthier again, but really it's up to you.
Yeah, I can't do it for you.
Yeah.
Cool. Awesome. I appreciate your time today. Thanks so
Thank
much. And
you.
we'll be rooting for you on Fox and everything else that you do.
All right. Well, thanks so much.
Awesome. Thanks, Nicole. Take care.
Bye-bye.